After lower limb, if we get the time tomorrow, we will have headaches, and then on Tuesday we will have GIT. Only two topics are left after this, right? So I want you all to revise everything. Let's start with the lower limb, guys. In first part, what we are going to see in lower limb, it is your pelvic bone, right? Here, this is your pelvic bone. In pelvic bone, what all things we are going to have? First of all, can you see these bones, guys? So here I am having iliac bone or ilium bone, then ischium, then pubis. All these three are the bones, right? Ilium is connected with the midline bone, the last bone which is present in the midline. This is what, guys? This is your sacrum. Sacrum and ilium are connecting with the joint, and this joint is known as what, guys? This is known as sacroiliac joint. On the upper part of the ilium, if you will see this part, guys, this part is known as what? This part is known as iliac crest, right? Iliac crest. In iliac crest, we are having two things, guys. The first thing here inside, it is what, guys? It is your inner lip, and the one which is outside, it is your outer lip. So inner lip and outer lip, these are the two things, right? What else we are having? Just at the ending of the iliac crest, this point is known as anterior superior iliac spine, ASIS. This point here is your anterior inferior iliac spine, AIIS, right? Now let's come to the pubic bone, guys. This bone is my pubic bone. Can you see this surface here? This surface is known as superior pubic ramus, and on the ending of this surface we are having this triangular shaped thing. This triangular shaped thing is known as what, guys? It is known as pubic tubercle. The triangular shaped thing which you can see here is your pubic tubercle. Two pubic tubercles are joining with each other, and this is what, guys? This is your pubic symphysis. The first question for today for you guys is what, guys? Pubic symphysis is what, guys? It is secondary cartilage. Okay, your secondary cartilage. The hole which you can see here, this hole is what, guys? This is your obturator foramen, right? Acetabulum, head of the femur, greater, so this is greater trochanter and lesser trochanter, right? Now, after knowing this much, let's discuss the ligament here, guys. Actually, let's make a picture about that ligament. Where we can make here. So this is here. It is my what? It is my ASIS. From ASIS till pubic tubercle, I am having one ligament. Can you name this ligament, guys? From ASIS till pubic tubercle, I am having this ligament, and this ligament is known as what, guys? This ligament is known as inguinal ligament. From where this inguinal ligament is coming, guys? For that you should know. On upper side here, I am having external oblique muscle. This external oblique muscle is going to give its ending, and this ending is known as external oblique aponeurosis. So inguinal ligament is nothing but the extension of external oblique aponeurosis, which is starting from ASIS till pubic tubercle, right? What else you should know about this, guys? The middle point of this inguinal ligament here, this point is known as midpoint of inguinal ligament. Everything what we are studying right now, it is important, guys, for the next few topics. Let's write about the hip first. So the sacrum is joined with, किससे जुड़ रही थी बच्चों? Sacrum was joining with ilium, and they will make a joint. Name of that joint is what, guys? Name of that joint is sacroiliac joint. The name of the joint is sacroiliac. Then we have studied about iliac crest. What is iliac crest, guys? Iliac crest is, can you appreciate this thing here? The upper part of the ilium. This is your iliac crest, right? In iliac crest, we are having low, the inner lip and the outer lip. Okay. This iliac crest can be felt or can be palpated by your fingers. Palpated by the fingers, right? So when we have did the practicals for IM injections, we palpated iliac crest as well as the ASIS, right? Then the next thing is pelvic brim. What is pelvic brim, guys? Pelvic brim is the opening of your bony pelvis. The opening of bony pelvis is what, guys? Opening of bony pelvis is pelvic brim. Remember, guys, pelvic brim is different from pelvic iliate. This is different from pelvic inlet. Okay. Where you are going to study pelvic inlet, guys? You are going to study pelvic inlet in gynec. When you are studying about the normal vaginal delivery, we will measure the pelvic inlet. If pelvic inlet is appropriate, then only a woman can deliver by vaginally. Otherwise, we have to go for the secondary option, that is surgery. Name of that surgery is LSCS, lower segmental C-section, right? We are having pubic symphysis then. Already discussed, pubic symphysis is what, guys? It is a place which joins two pubic tubercles. So two pubic tubercles are joining with each other and they are both each other with the help of this secondary cartilage. Name of this cartilage is what? Is your pubic symphysis, right? Then we are having ASIS. It is a landmark, guys, which can be felt at the tip of iliac crest, already discussed. Then we have studied about inguinal ligament. Inguinal ligament is what? Inguinal ligament is the extension of inguinal ligament is extension of external oblique aponeurosis from where to where? From ASIS to pubic tubercle, right? And the midpoint of this is known as what, guys? The midpoint of inguinal ligament is midpoint of inguinal ligament. We have one more thing, guys, that is your mid inguinal point. What is mid inguinal point, guys? Mid inguinal point is the midpoint of imaginary line. And this imaginary line is from where to where, guys? This imaginary line is from ASIS till pubic symphysis, right? From ASIS till pubic symphysis. This is the catch, guys. See, earlier what we have made? Earlier we have made the inguinal ligament, right? What else now we know? So there are two pubic tubercles, and these two pubic tubercles are mixing with or joining with one ligament or cartilage. This cartilage is what, guys? It is a secondary cartilage. The name of this cartilage is pubic symphysis, right? What I am trying to tell you here is from ASIS till this image, pubic symphysis. The dotted line which you can see here, it is your imaginary line, right? This imaginary line is also having one midpoint. And this midpoint of imaginary line is known as mid-inguinal point. This is known as what, guys? Mid-inguinal point. They both are very, very important as per exam perspective because in Viva teacher can ask clinical perspective of midpoint of inguinal ligament as well as clinical perspective of mid-inguinal point, right? What you should know about mid-inguinal point, guys, just below the mid-inguinal point, just below the mid-inguinal point, we have one artery. And it is very important artery, guys. Name of this artery is what? Name of this artery is femoral artery. What about midpoint of inguinal ligament? Midpoint of inguinal ligament, if you will go above and deep inside it, above and deep inside it, you will find one more opening. And this opening is what, guys? This opening is your deep inguinal ring. Name of this opening is what, guys? It is your deep inguinal ring. Understood, guys? Any problem until now? Are we going good? Is anyone watching? Let's write about something about the obturator foramen now. What is obturator foramen, guys? The obturator foramen is large oval shaped opening where it is present, guys. It is present in the hip bone, right? And this opening is having a small passage, and this small passage is known as what, guys? It is very important term which you should know. This small passage is known as obturator canal. Obturator canal. Why this obturator canal is important? Because intestines can come out from this canal also, and that kind of hernia is known as obturator hernia, which we are going to discuss in the last. Okay. From obturator canal, what all things will come out? From obturator canal, your obturator nerve, as well as your obturator vessels, artery and vein. Obturator artery, obturator vein, and obturator nerve. All these three things are going to come out. Can you see it here, guys? So this is my obturator foramen. In obturator foramen, somewhere here, I am going to have my obturator canal. This will be my obturator canal, and the other thing will be covered by a thin membrane but very strong membrane. Okay, and this membrane is again known as what, guys? This membrane is known as obturator membrane. This membrane is known as obturator membrane. So this canal, other than this canal, this obturator foramen is having a covering, and this covering is thin but strong. What is the name of this covering? Already written someone. The name of this covering is obturator membrane. Good. Any problem until now? Okay. Now let's see the shapes of the pelvis, guys. These shapes of the pelvis are again very important, even for now as well as for FMG. When I was giving FMG, I had this question in my exam, and they asked me this shape, guys, gynecoid shape. So they correlated gynecology with anatomy, right? In total, how many shapes we are having? In total, we are having four shapes. One, two, three, four, right? The first shape, this kind of shape is known as what, guys? It is android shape. The second one is gynecoid shape. Third one is anthropoid, and fourth one is platypoid. But you should remember, guys, android shape is most commonly in males. Gynecoid shape is most commonly in females. Anthropoid is rare. It is rarely seen in both males as well as females. And platypoid, it is only seen rarely in females. Other than that, you have this image. I would suggest you to read everything, whatever is written in this image. Okay. Then let's come to the femur, guys. So Femur is what, guys? Femur is the largest and the heaviest bone of human body. It is the longest and heaviest bone of human body, right? Then patella, guys. For patella, you should know the two functions of patella: the primary function and the secondary function. What is primary function, guys? Primary function is knee extension. Primary function is what, guys? It is knee extension. This knee extension is doing what, guys? It is increasing the leverage that the tendon connects, right? And the second function is what, guys? Second function is protection. Protection of the knee. So patella is doing what, guys? First of all, patella is doing the extension as well as it is protecting the knee joint. Okay. What about tibia and fibula, guys? So in tibia fibula, they are the bones of the legs. And one thing here which you should know, which already has been asked, it is what, guys? It is fibula doesn't articulate with femur. So femur and fibula, they both will not join with each other in the knee joint. Okay. Can you see, guys, tibia and fibula here? How to remember which one is tibia or which one is fibula? T4 tibia, T4 thick, right? The thick bone is the tibia one, fibula one is the thin bone. Okay. One more thing which you should know here is what, guys? The medial malleolus is on the tibia and the lateral malleolus is on fibula. So it is the only place where your medial and the lateral malleolus it is different, right? But in elbow it is coming out from the same bone. Again, the medial malleolus is on the tibia and the lateral malleolus is on fibula. Okay. Then we are having the foot bones, guys. Names of these foot bones, what we call them? We call them tarsus. Tarsus bones. In this tarsus, we are having some group of bones. What are the name of these bones, guys? So we are having calcaneus, also known as heel bone. We are having talus, cuboid, navicula, and last is cuneiforms. Last is what, guys? Cuneiforms. In cuneiforms, we are having three different cuneiforms. What are the ones, guys? So we are having medial cuneiforms, we are having intermediate cuneiforms, and we are having lateral cuneiforms. Medial cuneiform, intermediate cuneiform, and the lateral cuneiform. Okay. Metatarsals. How many metatarsals are there, guys? Metatarsals are total 5 in number. Okay. And what about phalanges? Yesterday also I have told you that total we are having 14 phalanges in one limb, that is 3 for each fingers and 2 for thumb. 3 for each fingers and 2 for thumb. Okay. Navicula is your commonly FMG asked exam question, guys. What they will do? They will give you the X-ray of the foot and they will make an arrow on this bone. Either this bone will be the fractured one, So they will ask which bone is getting fractured, or they will simply ask what is the name of this bone. How you will differentiate navicula with another bones, guys? This navicula is a boat-shaped bone. Is a boat-shaped bone. रिमेंबर लाइक दिस. बोट को हिंदी में नाव बोलते हैं. नाव हमारी क्या है? नाव. ठीक है. Done, guys. Let's come to the clinical aspect of the hip. In ASIS, till pubic tubercle, I am having the ligament. That name of the ligament is what, guys? Name of that ligament is inguinal ligament. What is the name of that ligament, guys? It is your inguinal ligament, right? And the midpoint of inguinal ligament is midpoint of inguinal ligament. The midpoint of imaginary line is mid-inguinal point. Now, why I have told you that it is important, because here we are going to have some exam questions. First of all, what we have discussed, from the midpoint of inguinal ligament just above and deep to it, we are having deep inguinal ring. And this deep inguinal ring is very important, guys. Why? Because if intestines are coming out from this inguinal ring, if intestines are coming out, then it is a site for the hernia. Can anyone tell what kind of hernia it will be, guys? It is a site of hernia, and the name of this hernia is indirect inguinal hernia. So, inguinal hernia is of two types: direct inguinal hernia and indirect inguinal hernia. What we are going to have? We are going to have indirect inguinal hernia. How it will happen, guys? So these intestines will come out from the deep inguinal ring, then it will go to superficial inguinal ring or superficial ring, and from superficial ring, these intestines will come to the scrotum and they will give swelling in scrotum, right? This kind of hernia, which is coming out from your deep inguinal ring, then the superficial ring, then the scrotum, this kind of hernia is what, guys? This kind of hernia is indirect inguinal hernia. Great. Second is midpoint of inguinal ligament. So just below the midpoint of inguinal ligament, we are having this thing. This is what, guys? This is your femoral artery. And this femoral artery is very important. Why this femoral artery is important? Because from this femoral artery, we are going to do some clinical things. What are they? We can do ABG. We can do ABG. We can do angiography. We can do angioplasty. And we can do stenting of the heart. All these things are important, right? They are coming out from, they are from where we are going to do all these things. We can do all these things from femoral artery, right? Then the medial side, towards the medial side of the femoral artery, we are having one more structure, that is femoral vein. This femoral vein is important for what, guys? This femoral vein is important for central lining. Done, guys? Then the next thing which we are having here, the green color thing, what is this, guys? This is our femoral. So in this place we are having the lymph nodes, and these lymph nodes are known as cloaquet lymph nodes. Cloaquet lymph nodes. And cloaquet lymph nodes are present from the femoral ring until the sinus opening. So these cloaquet lymph nodes are going to be one of the contents in your saphenous opening also. Let's make the diagram, guys, and let's try to find out what is the femoral ring. Okay. So first of all, what we are going to make? First of all, we are going to make the ASIS, right? Then we are going to make pubic tubercle, and on this side of the pubic tubercle, on the medial side of the pubic tubercle, what we are having? We are having pubic symphysis, right? From ASIS till pubic tubercle, what we have studied? We have studied it is our inguinal ligament, right? And from ASIS till pubic symphysis, it is our imaginary line. Both of them are going to have the midpoints, and both midpoints are important for us, right? So we are having midpoint of inguinal ligament as well as mid-inguinal point. Just above and deep, just above and deep to the midpoint of inguinal ligament, we are going to have one ring, and this ring is what? This is your deep inguinal ring. Just below this midpoint, the mid-inguinal point, we are having one artery, and name of this artery is femoral artery, right? Just medial to the femoral artery, we are going to have one more thing. This thing is what, guys? This is your femoral vein. Done. Now, try to understand, guys. We are having external oblique aponeurosis. This external oblique aponeurosis is coming to the ASIS. From ASIS till pubic tubercle, it is your inguinal ligament. Then we are having from pubic tubercle, we have already studied that here we are going to have superior pubic ramus. What is this thing, guys? This is your superior pubic ramus, right? So in superior pubic ramus, what will happen now? My inguinal ligament is going to give some curves from medial side to the lateral side. And these curves are known as what, guys? What is the name of this ligament? Anyone? The name of this ligament is lacunar ligament, because it looks like what, guys? It looks like the moon shaped ligament, right? And this lacunar ligament is going to continue on the superior pubic ramus. The lacunar ligament is continuing on the superior pubic ramus, and this ligament is known as, guys, Cooper's ligament. Inguinal ligament, lacunar ligament, and Cooper's ligament. The Cooper's ligament is going to give one very thin fibrous line towards the inguinal ligament. This is known as thin fibrous septum. And this thin fibrous septum is attached with what, guys? It is attached with my femoral vein as well as the inguinal ligament. When it attaches to the inguinal ligament, it makes the femoral ring. When it is attaching to the femoral vein, it is giving me the lateral boundary of my femoral ring, right? Let's discuss the boundaries of the femoral ring here only, guys. So this place which I got, the circle which I got here, this is what, guys? This is my femoral ring. In femoral ring, I am having superior, medial, inferior, and lateral boundaries. What is the superior boundary, guys? Superior boundary is my inguinal ligament. Medial boundary is my lacunar ligament. Inferior boundary is what, guys? Inferior boundary is Cooper's ligament. Another name of Cooper's ligament is what, guys? Another name of Cooper's ligament is pectineal ligament. Cooper's ligament as well as pectineal ligament. And last is what, guys? Last is my lateral boundary. And this lateral boundary is thin fibrous septum. And this thin fibrous septum is attached with femoral vein. Okay, this thin fibrous septum is attached with femoral vein. Any problem until now, guys? Now let's come to the facial aorta. What is facial aorta, guys? Facial aorta is dense fibrous layer. Facial aorta is dense fibrous layer which is connected, sorry, which is covering the outer side of pelvis as well as thigh. Right, guys? Facial aorta is going to give me what, guys? Outer covering of pelvis and thigh. What is the origin, guys? That is your question. What is the origin of your facial aorta? The origin of the facial aorta is ASIS and outer lip. Outer lip of what, guys? Outer lip of anyone? Iliac crest. Outer lip of iliac crest. Guys, let's discuss this diagram then. Acha, before that, let's do this. So here, can you see this white color shading here? This white color shading is nothing but your facial aorta. Okay. This facial aorta is coming from where? This facial aorta is coming from ASIS and it is going parallel to the inguinal ligament until the pubic tubercle. Then it is going down, forward, and lateral. And then it is giving the medial boundary, which is again attaching to the outer lip. Again, it will get spread like this. I hope you are understanding what I am trying to say here. This is your facial attack. Origin is ASIS and outer lip. What is insertion? Anyone who can give me this answer, guys? What is insertion? Insertion is on lateral condyle of tibia. And here we are having one tubercle. Name of this tubercle is Gerdy's tubercle. Done. Try to understand, guys, here. Can you appreciate this muscle? This muscle is one of the biggest muscle of human body, and The name of this muscle is psoas major muscle, right? Then the muscle which is attaching with my ilium, that is what guys? That is your iliacus muscle. This psoas muscle and iliacus muscle, they both are joining to a place, right? They both are kind of joining to a place, so they both are mixing with each other. Beyond this place, they both will be combined, and together we are going to call them iliopsoas muscle. Iliopsoas muscle. Done, guys. From iliopsoas muscle, or at the origin of here, we are going to have one structure which is going to come down, and the name of this structure is what, guys? The name of this structure is femoral nerve. It is what, guys? It is your femoral nerve. We already have discussed about this femoral artery, femoral vein, and now next thing which we have discussed is what? Is a femoral ring, from which these green color dots, they are what? They are clockwork lymph nodes. This is a bit of complicated diagram. For understanding the fascial atta, let's make a diagram, guys. So I don't have enough space. Take one page and make in that diagram, guys. This is my ASIS here. This is pubic tubercle. From ASIS to pubic tubercle inguinal ligament, we are discussing the fascial atta. So from ASIS till pubic tubercle, I'm having, what is this? This is my fascial atta, right? Fascial atta from pubic tubercle is going to go down, forward, and lateral. Until here, the fascial atta will be smooth. Okay. After this, it will get irregular, and it will attach to the outer lip of my iliac crest, and this will give me my medial margin. Can you appreciate this opening, guys? This opening is named as saphenous opening. And saphenous opening is nothing but a modification of fascial atta. So in total, we are going to have two different modifications of fascial atta, guys. The first modification is what, guys? First modification is the thing which we have discussed, that is your saphenous opening. And the second is what, guys? Your compartment of thighs. Okay. What are this compartment of thighs, guys? Suppose this is a person's thigh. What we are going to do? We are going to cut this thigh like this, and we will watch it from up. We are going to cut the thigh like this, and we are going to watch it from up. So what all things we are going to find? This is my thigh, right? In between, I'm going to have one bone, and this bone is what, guys? This bone is my femur bone. This is anterior side, this is posterior side. On the posterior side of the femur, you will find it is pointed, pointed. Posterior side of the femur is pointed. So what will happen? My fascia lata will go inside and attach with this posterior part of the femur, and it will divide my thigh into three parts: anterior compartment, posterior compartment, and medial compartment. Anterior compartment, posterior compartment, and medial compartment. This is my second modification. Now let's come to the bigger modification, that is your saphenous opening, or more important modification, that is your saphenous opening, right? In saphenous opening, what all things you will write? Write the heading saphenous opening first of all. So we are going to write the fascia lata is coming from ASIS till pubic tubercle, and fascia lata is going to go from pubic tubercle. It is what, guys? It is parallel to inguinal ligament. After this, what is going to happen? My fascia lata is going to go down, forward, and lateral. Is going to go down, forward, and lateral. This down, forward, and lateral movement of the fascia lata, here this fascia lata will be smooth. Okay, and this smooth fascia lata is known as superficial stratum. It is known as what, guys? It is known as superficial stratum. Can you appreciate here, guys? So from pubic tubercle, fascia lata is going down, forward, and the lateral side. And this down, forward, and lateral side, it is smooth surface. And this is what, guys? This is my superficial stratum. After this, my fascia lata will take the irregular margins and make the medial side of my saphenous opening. So where it is going to go now? It is going to go medial side, and then it will attach to outer lip of iliac crest. This line is known as what, guys? This is my deep stratum. Okay, guys. After attaching to iliac crest, it will shed off, ऐसे नीचे की साइड में गिर जाएगी. ठीक है. Next question which they will ask from the saphenous opening, guys. It is the diameter of saphenous opening. The diameter of the saphenous opening is what, guys? It is around 3 to 4 centimeters. Then the next question is content of saphenous opening. So the content of saphenous openings are what, guys? First of all, it is the great saphenous vein. Secondly, it is branches of medial femoral cutaneous nerve. Third, it is lymph nodes. Fourth, it is superficial external pudendal artery, and fifth one is superficial epigastric artery. All these are what, guys? All these are my the contents of saphenous opening. What you should know about great saphenous vein, guys? Great saphenous vein is the longest vein of your human body. It is the longest vein of human body. I hope everything is going fine, right? Guys, see, somewhere here I am going to have my great saphenous vein. Okay, and this great saphenous vein is joining with the femoral vein. The great saphenous vein is joining with the femoral vein, and this great saphenous vein is known as what, guys? Is the longest vein, right? Great saphenous vein. It is the longest vein of your human body. It is going to connect with the saphenous vein, and this connection here is known as what, guys? This connection is known as spheno femoral junction. Sphinofemoral junction is again a very important thing which you are going to have. When you will start studying about the varicose vein, then you will understand about then you will understand the importance of this sphinofemoral junction. Understand, guys? One more thing which you can understand from the great saphenous vein, or one more thing which you will have to learn about great saphenous vein is what, guys? That is, it is coming from where, guys? It is coming from, or it is attached to medial malleolus. It is attached to what, guys? Medial malleolus. I hope everything is clear, right? Until now, what we have discussed? We have discussed about the inguinal ligament, the imaginary line, the midpoints of the inguinal ligament and the imaginary lines, right? Here, the midpoint of inguinal ligament was deep inguinal ring, midpoint of imaginary line was mid inguinal point, and from here, femoral artery was coming out, which was helpful for what? Which was helpful for ABG, angiography, angioplasty, and stenting of the heart, right? Then we have studied about the medial side of the femoral artery, it is femoral vein, that is central lining. And then we are having some lymph nodes. The name of those lymph nodes was Cloquet lymph nodes, right? Few things which you should know about femoral ring and saphenous opening, guys. That is what. So the femoral ring, sorry, and saphenous opening. So this femoral ring is what, guys? It is the entry point, guys. Entry point of the hernia, and saphenous opening is exit point of the hernia. So one hernia is going to enter from the femoral ring, and then this will come out from another opening. This kind of hernia is what, guys? This kind of hernia is femoral hernia. This kind of hernia is femoral hernia. Done. Now let's discuss the femoral hernia. Femoral hernia is due to what, guys? Femoral hernia is due to weakening of femoral canal. It is due to weakening of femoral canal. What is femoral canal, guys? So the area between your femoral ring and saphenous opening. The area which is present in between the femoral ring and the saphenous opening. This area is what, guys? This area is known as femoral canal. And if we are having any kind of weakening here inside the femoral canal, the patient can have femoral hernia. It is due to the weakening of femoral canal. Because of that, what will happen? Because of that, the intestines will enter inside where, guys? Inside femoral ring and exit from saphenous opening, right? And they will give one swelling. This swelling will known as femoral hernia. Femoral hernia you will see more in females than in males. Femoral hernia is more in females than in males. What kind of females these are will be, guys? These will be elderly female patient, or another one is multiparous female patient. What is multiparous, guys? A female who has given more than two childbirth. This kind of female is known as multiparous female. जिस भी फीमेल ने दो से ज़्यादा बच्चे पैदा किए हैं, we will call her multiparous female. Okay. Now let's label this diagram, guys. So there are so many things in diagram. Few of them are already known to you guys. Let's start from the femoral nerve. Which one is femoral nerve, guys? This one here. Can you appreciate this one? This is your femoral nerve. Then we are having this black color circle. This black color circle is what, guys? This is your deep inguinal ring. Then the purple color line which you can see, guys, this line here, the purple color line, right? This line is what, guys? This line is your thin fibrous septum. Then just above the purple line we are having this blue color thing. This is your inguinal ligament. Then inguinal ligament is converted into lacunar ligament. Then lacunar ligament is converted into Cooper's ligament. And in between the circle is there, and this circle is what, guys? This is your femoral ring. Another name of Cooper's ligament is what, guys? Another name of Cooper's ligament is pectineal ligament, right? After that, we are having what, guys? This canal here, it is your femoral canal. Acha guys, what is the length of femoral canal? Can you write it in the comments? It is from 1 to 2 centimeter. Then we are having the saphenous opening. This full gray covered thing is what, guys? This full gray covered thing is your fascia lata. And then we are having the longest vein, that is great saphenous vein. Then we are having the medial malleolus, which I have already labeled. On this side, we are having the red color line, that is the junction of your great saphenous vein and femoral vein. We call it spheno-femoral junction. It is what, guys? Spheno-femoral junction. Then we are having femoral vein. Then we are having femoral artery. Then this thing is what, guys? This thing here, it is your superior pubic ramus, right? It is what, guys? It is superior pubic ramus. And the upper point here, which is the first thing which we have studied today, that is ASIS. So we have covered almost everything here except the midpoints, right? The next question in Viva a teacher can ask you is about the relation of pubic tubercle with saphenous opening. Anyone who can answer this, guys? What is the relation of pubic tubercle with saphenous opening? What is the relation of pubic tubercle with saphenous opening? I'm having pubic tubercle here and saphenous opening here. The relation of pubic tubercle and saphenous opening is what, guys? It is inferior and lateral. The saphenous opening is inferior and lateral to the pubic tubercle. How much, guys? It is around 4 centimeters inferior and lateral to the pubic. It is around 4 centimeters inferior and lateral to the pubic tubercle. See, guys, this diagram here, I am having this femoral ring. Then this blue color thing is again the femoral vein. Then this canal is what, guys? This canal is my femoral canal. What you should know about femoral canal, guys? This femoral canal is actually not an actual canal. This canal is not actual canal. It is just a passage between your femoral ring and saphenous opening. Okay, and length we have already discussed, it is around 1 to 2 centimeters. This is your saphenous opening. Done, guys. Now try to understand, guys, here in this diagram a person is having weak femoral canal. Okay, if the person is having weak femoral canal, what will happen? Intestines which are present here, they will try to enter inside the femoral ring, then they will travel inside the femoral canal, and what will happen? They will come out from your saphenous opening. This kind of hernia is known as your femoral hernia. This kind of hernia is known as what, guys? It is your femoral hernia, right? So this kind of femoral hernia which you are watching here, it is having four things. First of all, the entry point and the exit point, which we already discussed. Entry is femoral ring, exit is saphenous opening. Okay. Now, what is this content, guys? And this content is also covered with a layer. So the layer of this content as well as the content, both of them are your exam question, guys. So the content is made up of what? Content is made up of either the bowel or the omentum. And the outer layer in which this bowel or the omentum is covered, this layer is what, guys? This layer is nothing but peritoneum. This layer is nothing but peritoneum. So let's write all these four things, guys. So in femoral hernia, we are having entry point, we are having exit point, we are having the contents of this hernia, and these contents are covered by the sac. All these four are the questions of femoral hernia. In entry point, we are going to have it is femoral ring, exit point is saphenous opening, content is bowel and omentum, and sac is made up of what, guys? Sac is made up of peritoneum. Sac is made up of peritoneum. Okay. What are the clinical features you are going to see in femoral hernia, guys? The clinical features you are going to see in femoral hernia, first of all, you are going to see inguinal scrotal swelling. Okay, you are going to see inguinal scrotal swelling. This inguinal scrotal swelling is usually below inguinal ligament. This is usually where, guys? This is usually below inguinal ligament. Okay. When this kind of patient will come to you in your OPD, suppose you are sitting in the general OPD, general surgery OPD, and then a patient is coming to you and that patient is saying, I am feeling some swelling is there. The first thing you are going to do is what, guys? You are going to ask the person to cough. Whenever the person will cough, what will happen? This swelling will try to come out. So this swelling will try to come out from the when the patient is doing cough. We call it what, guys? We call it cough impulse. So the cough impulse can be either the positive cough impulse or negative cough impulse. Positive cough impulse is seen in simple hernia and negative cuff impulse is seen in complicated hernia. Then you will try to push this swelling inside. We call it reducibility. So if the patient's hernia or the swelling is reducible, it is simple hernia. If it is irreducible or if it is not reducible, it is complicated hernia. The third thing which you should know here is about the pain. So if patient is having no pain, it is simple hernia, and if pain is positive, that is your complicated hernia. Done, guys. Once it is diagnosed, last what you can do the radiological analysis. So in radiological analysis, what you are going to discuss, in radiological analysis, you are going to do either the USG or CT abdomen, right? In this, you will understand if this hernia is either simple or the complicated, according to which you are going to do three different surgeries. What are the names, guys? The first surgery is Lockwood surgery. The second surgery is Lothinson's surgery. And the third one is McAvday surgery. Let's discuss all these surgeries one by one and finish it today. Okay? For today, this much is enough, guys. It's already 11:15. We have to sleep. We have to go tomorrow for the classes also. So we will finish this live session here and out. And from tomorrow, we will start prosepsis. Okay? The Lockwood surgery is what, guys? It is your it is done for so both Lockwood surgery and Lothinson's surgery, they both are for what, guys? They both are for simple inguinal hernia. So a simple femoral hernia. Okay, guys, they are done for simple femoral hernia. In Lockwood surgery, the approach you are going to use the approach you are going to use, it is what, guys? It is low inguinal approach. It is low inguinal approach. What is low inguinal approach, guys? So in this, we are going to give a horizontal cut below the inguinal ligament. That's why we call it low or below inguinal approach. Okay, then we are having the Lothinson surgery. This Lothinson surgery is what, guys? In Lothinson's surgery, you are going to have cut on your inguinal ligament. So you are going to cut where? Just on the inguinal ligament. This kind of approach is known as inguinal approach. This kind of approach is known as inguinal approach. And the last one is what, guys? Last one is McAvday surgery. This McAvday surgery is done for complicated inguinal hernia. So complicated femoral hernia. This is done for complicated femoral hernia. And what is the approach here? The approach is above inguinal vertical approach. Above inguinal vertical approach. That will be the this one, guys. So from above inguinal ligament, we are going to cut the person from its midline vertically till pubic symphysis. We call it above inguinal vertical. Okay, guys. I hope everything about the femoral hernia, fascia lata, saphenous opening, and the basics of your lower limb are clear.